Serge, welcome to part two of our segment here today. If you want to learn more about Serge's spirit animal and his background, listen to part one. Some fascinating stuff there, and also some really fascinating nuggets about entrepreneurship and grit, as we've learned. So let's get into our next topic, which is really around the transformation of home healthcare. I know this is an area that you're very, very involved in currently and really looking very hard at. There's so many ways that we really could have taken this particular topic, but what really fascinated me, and I think is something you've talked about, is how our parents really have influenced, I think, our focus and so many people's focus on how do we bring better innovation and technology into the home setting. So, since my parents were in their 60s, I've been thinking about how technology could be leveraged to make their lives better, to be more connected with me, to their grandkids, and maybe most importantly, how we could make their home setting safer. During the pandemic, we've all tried to use cell phones, iPads, FaceTime, all kinds of things just to stay connected with them. But it's really challenging just to get my parents logged into a Zoom call, let alone getting them on a webcam and to stay unmuted and so forth. I'm sure there's a lot of chuckling going on out there. And I'm sure many people can relate to me right now. But it feels like, it seems like you really feel confident that we're on the cusp of a transformative, maybe into even disruptive wave of innovations in elderly care. First, why is this an area of focus for you? And what are the rest of us not seeing about how innovation will happen in this space?
Yeah. So there's a lot to talk about here, but I would start with, my background, my culture, and how I was raised. So, I grew up in what was the former Yugoslavia, and it was very common that you have multi-generational households. The main reason being because economically, young people could not afford to move out and live on their own. And I remember vividly in my 20s, I couldn't wait to get the heck out of my parents' house. I was annoying them; they were annoying me. Then the Civil War started, and I came to the United States at the age of 27. So today, 30 years later, basically, my parents live in Croatia, and I call them every morning. Okay, and thanks to technology, it's a free call.
And I've seen you call your mom.
So already there, and they're, both my brother and I here, and they're over there. So you're always concerned, like, okay, my father's 97, he's in pretty good health, but like, God forbid something happens, and something will happen, it's just inevitable. Like, what do I do? How do I help them? Now, I have a similar scenario in the United States where my wife's mother, who's Italian, who doesn't speak in English, lives alone. And in the last year, she fell twice. She has the pendant to call an ambulance, but she doesn't want to press the button, although she knocked her tooth out, because it's expensive, right? So you start thinking about this whole mindset. And then the third factor, I believe suburbia is a very, I live in suburbia. I think it's a very hazardous urban design. And what do I mean by that? I mean by that people live way too isolated, especially the elderly, right? Yeah. If you look at the urban design of old cities throughout the world, they all have streets that lead to squares. So there's a natural inclination for people to congregate, to interact, and so on and so forth. So, so first of all, when it comes to elderly care and just in urban planning, I would expect to see changes in the US in the sense that urban design is such that people have the ability to interact, because we are social animals. I mean, that's we all know that, right? The second thing is that, if people live alone, isolation is a huge problem, right? And then you layer on top of that social determinants of health, which basically includes the socioeconomic conditions under which impact people's health, things such as access to housing, access to food, income level, education. That's a whole next layer that you need to take account how these people will be affected, right?
Yep.
And people are living longer, which means they'll live longer with more diseases and comorbidities, right? So what prompted me is, first of all, my personal experience from me and my wife and our parents, and secondarily, I see friends and family, and then thirdly, it's just like as a business person, you know that it's a huge market and it's just going to get bigger.
Yeah.
Now, if you look at innovation in healthcare, there's actually quite a bit of innovation from a delivery model standpoint, home, hospital at home, those kind of things on a clinical delivery side. However, on the kind of direct to consumer side, not so much. So in preparation for our call, actually, I Googled last night, high-tech innovations for elderly. And the first thing that showed up in my Google search findings is an article from May 7th, 2014.
Wow.
Okay,
Wow.
so that was the first return. Now, when down the list, everything is dated 2019, 2020. We're nearly halfway through 2021. How come there's no articles about that, right?
Yeah.
So when you look at kind of direct-to-consumer offerings such as canes, walkers, alert systems, it's pretty. It's not keeping in step with innovation in other places that we see everywhere. So really, that's the genesis of kind of why I started getting really interested in that space.
Yeah, I mean, we really haven't seen things evolve relative to that consumer-based care the way that we have in other technologies. I mean, we know healthcare is slow, but it shouldn't be this slow. You mentioned, as we were talking about this, that there are some really, I think, exciting and fascinating potential innovations. Some of it will sound very futuristic, but I think, as we've seen, you have to be able to look a little bit into the future, dream a little bit, and project a little bit, and then things start to happen and they start to become reality. So talk to us a little bit about some of the really exciting innovations and or technologies that you're looking into and that you think have promise.
Yeah, so I first looked at the device area of things, and I noticed there's some interesting things going on there. But what's happening right now, it seems that most of the focus is on quote unquote wearables in general, right? And although I have a smartwatch from iWatch, I have Amazon Halo, and I've tried all the gadgets out there, they really don't do it for me from the standpoint that I always have to worry about them running out of battery. So that for me, that's an issue, right? Because I'll forget, so there's no consistency. When you look at the elderly in their home, I believe, and this is based on my experience with our previous company, where the reason for our success, by the way, that we stayed within the text messaging channel, okay, which is the most used app on a phone. We didn't have a separate app. So what we learned is it's not new learning, it just reconfirmed for us that staying within existing behavior is the most important thing. So if I'm living in my home, I don't want to wear any pendants, or I want to be able to, every time I'm in front of the mirror in the bathroom twice a day at least, right? So in the morning and the evening. So there are some smart mirrors that can collect data, but that's where the market should go. So the mirror should be smart, it should be collecting data, it should be displaying data, and every time I touch any door handle and any door in my house, it should be collecting some kind of data. When I sit on my couch to watch TV, there should be smart fabrics collecting data, right? So I really believe that, and this is not just for elderly, this would be for anyone ultimately. So I can see a lot of innovation in that. I've seen a company that has a piece of fabric that gets put underneath the hospital bed and collect some vitals. So that's very unobtrusive. I've seen some smart fabrics like smart sleeves and smart shirts that collect data. So I can see that this, combination of ambient, non-invasive data collection with some, watches and stuff is basically kind of the future in terms of on the device side. On the services side, there's some interesting concepts. So like one company I really like is called Mom's Meals. And what they basically do, they have health plans pay them to deliver meals for their members based on their disease state. So if you are a diabetes patient, you have one menu. If you're a cardiology patient, you have a different menu. Or if you have comorbidities, it'll be adjusted. And I think that's really clever because ultimately food is historically a social gathering also, right? Yeah. So I think if you deliver food and you can, it's much easier to establish a quote unquote relationship. And over time, the relationship is very valuable and can be monetized, so to say, right? And I hate to put all this in business terms, but that's the fact, right? Yeah. So another two concepts that came out of Europe that have not been fully commercialized that I really like, which is basically going back to basics. And I'll give another analogy before we get in food. It used to be that poor people in Europe, at least from where I came from, or my wife comes from, the poor people basically ate soups with vegetables and beans because that's all they could afford.
Right.
They could not afford meat.
Right. Yep.
Today, if you go in a high-end healthy restaurant, they serve you the same kind of food because it's the healthiest.
Yeah.
That was eaten by poor people 100 years ago.
That's a yeah, you're right.
It's really interesting, right?
Yeah,
and
the farm to table movement.
Exactly. So if you look at the healthcare and the whole fundamental of how the societies and tribes are structured in I believe in Sweden or one of the Scandinavian countries, maybe in Denmark, I'm not sure. They're I don't know if they're pilots or they're actually implemented on an ongoing basis where you have multi-generational settlings, right? Or where in a young family with the child lives in one, call it bungalow, and an elderly couple lives in another bungalow, and they'll watch the kid while they're at work.
Gotcha.
So it goes back to the whole village, helping each other. So that's one thing that I think is kind of a no-brainer. And then the second thing is, I believe in Holland, they did a pilot where college students could get free room and board in the city of the university they're attending if they live with an elderly person to help them with the groceries and stuff like that. Right?
That's smart.
So I thought that was really fun. And then there's this company in the United States called Papa Health, which is, I think, it's not there yet, but it seems it's going in that direction. You know, their tagline is family members on demand. But you know, I think these are some models that could be really interesting. You know, another model that I kind of thought about a lot, you know, could you have a it's not really Airbnb, but could you have a marketplace where seniors could, you know, figure out how to live together and move in together, right? So I really believe that the social component is so important to mental health and overall health.
Yeah, that's fascinating. You just gave us so many great ideas. I want to delve into so much of that, but let's maybe go back a little bit to technology. You know, as we talked about this particular topic, the thing that kept occurring to me is that from a business opportunity, from a marketplace opportunity, from a technology enablement, there are some, you know, big players out there. There are health insurers, there are health systems that are very connected to these populations that are out there. So are the market opportunities a B2B opportunity or a B2C? Are they both? From a technology standpoint, how do you see that?
I would say they're both, right? I mean, if you go into the hospital system, there, you know, since we have value-based care, their main, you know, goal is, you know, reducing and eliminating 30-day readmissions, right? So that's why the hospital at home is interesting, because instead of the patient being for, I don't know, 10 days in a bed in the hospital, they can be only 5, and then they send them home, and at a fraction of the cost, I don't know, with a 30-40% discount of in hospital care, they can get the same or better care. Right. And there's data that shows basically that you know, people tend to do better, you know, recovering in their own environment. And I believe, you know, John Hopkins out of Baltimore started that about 10 years ago. They piloted it, and then they created template. About 20 plus hospital systems signed up. And only last year, due to COVID and due to shortage of beds, I believe over 90 hospital systems got, you know, on a fast track approval from the FDA to do the same. So I think there's innovation. You know, I believe the CEO of Aetna said that in the future, the hospital will be only ER and OR, meaning operating room, right? Yeah. And that makes sense. And, you know, that's a model innovation, but you need a lot of technology and process innovation to make that actually happen and work. Right. Yeah. I think the biggest problem in the US is interoperability, because, you know, that's the kind of the price of early success in innovation. You can see that by the telecommunication standards. You can see that especially with EHRs. If I go to Croatia, everybody's in the same EHR. Why? Well, because they got into EHRs only, I don't know, 8 or 10 years ago, and they brought it at the national level. It's a small country, and electronic prescribing has been there like consistently for, you know, for quite a while. Same things. I can get a better cellular signal on a remote island in Croatia that I can do in New Jersey. So why? Well, because they implemented the full-blown Ericsson system at once, versus in the US, it's been patched and the systems, and they don't. So I think one of the big issues in healthcare in the United States is data interoperability and ability to get access to that data. And you look at the big health plans, that a lot of them also increase grew through acquisitions, and you have systems that don't talk to each other. Sometimes they don't even know where to find the data in the acquired company. So there's a lot of challenges and there's some companies working on that.
Last question on this topic. We didn't touch on sort of analytics. So you talked before about fascinating to me, smart fabrics and devices and doorknobs capturing information. What do we do with this information? How do you see the analytics component of it? Not necessarily even from a monetization standpoint, but from a patient care standpoint, even thinking about things like loneliness and isolation. What are your thoughts on that?
You want it to be actionable data, right? So if you have a sensor that is placed in the bathroom and it says, mom went to the bathroom on average once a night in the last month, and now she's going 3 times a night, well, I should get alert saying, well, maybe mom has UTI, right? I mean, it's simple as that per se. I think that one thing that one has to be careful about, there's a lot of shiny objects talk there, like everybody's doing AI and machine learning and computer vision and blockchain, without even a lot of them don't even know what they're talking about, right? And they're just buzzwords. So I think it's when it comes to machine learning AI, the input and quality of the data is the most important factors. Garbage in, garbage out, and vice versa. So I think having consistently standardized good data that is at a sufficient scale and volume that it actually can do predictive analytics. Obviously, that's what everybody wants to do. I just question how many people truly have that, right? I mean, you remember Watson at IBM was all the rage 5-6 years ago. They did a project, I believe, at Anderson's Cancer Center in Texas. They canceled it after 5 years. They were just, and this was the quote unquote most powerful computer in the world. There's a great article, I lost it, but basically it's something along the lines, the NHS, National Health Services in the UK, invited Google engineers from DeepMind to introduce AI into their systems. And, I'm paraphrasing here. And the guys basically analyze the system and says, hey, if we fix this process and this process, you'll get a 40% improvement in efficiency. If we introduce AI, it's going to be a 4%. So, I think, we have to be really careful that we don't have the tail wagging the dog in these instances. But with all of that said, I think what's important is that when people design things, they take into account in the design of these systems and processes to account for all the things that are coming in the future, or they would like to implement when the sufficient data volumes are there, the quality, and so on and so forth. I think there's going to be also a big business opportunity, and I'm sure there already is, in actually sanitizing data. Making sure it's good data, it's valid data. So that's how I see it, and it has to be incremental, right? You can't expect. I mean, the best innovation is ultimately incremental. That's based on insights and needs that you learn through doing. Not you have to do to learn. You can't just read about it. You can learn only so much by reading, and then you ultimately have to do all the doing.
All the execution. So last question is, are we going to make things better for this very, much needed population, the elderly population, with everything that we're talking about? And how, what does the experience potentially look like going forward once we implement some of these things?
Well, look, I think it's going to get better, and it's gotten better. I mean, humanity is better off, right? I think it's going to be interesting to see. I think the Biden administration just submitted a proposal for I believe, $400 billion initiative for improving, elderly care in general. So ultimately, for things to get better, you need basically a systemic change, right? I mean, I think there's some places in New York State I heard where if you're a caregiver for a loved one and you're working, the state will actually pay you a full salary to stay home and take care of the person. Well, that makes sense, right? Because the worse things get, the more of a burden that person, even if they're uninsured, they end up in the ER.
Right.
So the burden is on society. So I think, yes, it's just a long road, right? Because the system is huge. There's so many disparities, and it will just take time and, yeah, just time and money, of course. People, it can't, not everything can be done by the private sector because somebody's going to pay for this. And ultimately CMS is the largest payer, right, in the country,
in the world,
right? And it's in their interest to save money by preventative measures, right? So
like anything else systemic, the only way it gets solved is for everyone to be involved, private, public, for all initiatives. Well, wonderful. Thank you so much, Serge. Those are really insightful and enlightening comments. Loved having this chat with you.
Thanks for having me. Enjoyed the conversation.